many of you have ever felt frustrated because you can't sleep, or you can't poop, or you simply don't have any energy and you're mysteriously gaining weight? Today on Dueling Doctors, 3 common ailments that leave millions of people feeling simply out of whack. You know what I'm talking about, when things with your body just aren't right. Today we're talking about insomnia, constipation, and thyroid problems. What causes these issues and how can we treat them? Different doctors from the world of holistic natural and conventional Western medicine square off on how to do just that. And get ready to go shopping in your cabinets for a cure. It's holistic and natural versus conventional health experts with different opinions and one goal: to help you live a healthier life. Dueling Doctors. Hi everyone, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from the world of both conventional Western and holistic natural medicine join us to debate and discuss the best ways to treat ailments and illnesses that affect most of us at some point in our life. Let's get started by introducing our guests. On the eastern side, we are joined by renowned doctor of acupuncture and herbal medicine, Dr. Daniel Chu. And with a more Western approach with a specialty in internal medicine, like me, we have Dr. Nancy Simpkins. Welcome. Our first topic today, the dreaded insomnia. It is estimated that approximately 48% of Americans suffer from symptoms of insomnia and that we spend $14 billion, that's billions with a B, dollars on treating it. Now, insomnia is thought to be difficulty in falling asleep or staying asleep or both. On average, people need about 7 to 8 hours of sleep because it really gives your body a chance to recuperate and recharge. Chronic insomnia can have long-term health consequences. Each of our experts has up to 1 minute to present a treatment plan, and then each will have the opportunity to respond to the other. We flipped a coin before the show to see who goes first, and Dr. Chu, you won the toss.
Now, traditionally, in the ancient days, a doctor in China would have thought that insomnia had to do with the mind, some kind of disruption of the spirit, they used to say.
So something weighing heavy on your mind?
Weighing heavy on the mind.
What sort of like stresses?
Some stress, worry, anxiety, depression. And it's quite funny that in modern days, primary insomnia is thought to have kind of the same roots. What we do nowadays is very similar to what we used to do in the ancient days. You know, the doctor of traditional medicine would sit down with the patient and would talk to them and try to find out what the roots are. Try to see if there's something other than just worry and insomnia and depression and anxiety. There's something physical, and there's nothing physical than there's a lot of talk therapy, there's a lot of acupuncture that can be done, and herbal medicine can be done.
So acupuncture in itself, a treatment, or how many treatments, let's say?
Well, you know, everyone's different. Acupuncture is very good at calming the nervous system down.
Because it takes about an hour or 40 minutes.
It can take a half hour, it can take an hour, it depends.
So really. It really gives a patient a chance to just sit in one place with needles in their face or body and sort of kind of calm down.
That helps too, but the acupuncture actually, all acupuncture points are about half a millimeter away from a nerve. All the nerves talk to the brain, and acupuncture has been shown in studies to really calm the fight or flight response.
Sure, and what about, is there any kind of supplementation you would recommend?
Well, traditionally, depending on what the patient has, how the insomnia were to be created in the body, so to speak, you know, or the acupuncturist, the doctor of traditional medicine would prescribe a formula. An herbal formula.
I typically, for patients who don't want prescription medication, have offered melatonin in the past. It works really good because it's natural. And
acupuncture helps the body produce more levels of melatonin. Yeah, that's one thing that
does. But you could also take it in conjunction with acupuncture as well.
You could. There's no reason why you couldn't do that.
Because I find it works actually well for people with jet lag and sleep work disorder, where they work long hours or they change shifts.
Sure.
All right, that's interesting. I find it interesting that, you know, it's all about stress. And I think we live in this world where we're 24/7. We're all going to have stress. And maybe I can't make it to my acupuncturist for 40 minutes or a half an hour, and they come and see you, and I say, I can't sleep, Dr. Simpkins, and I need to sleep because I'm a busy person.
Right. With all due respect to my Eastern colleague, we do believe stress plays a huge part, and we do take a history to ask patients whether it's falling asleep or staying asleep, or which part of the sleep cycle is disrupted, or is there something new in their environment? Did they change their morning exercise to night exercise?
Very important that lifestyle changes. not only new job, family issues can change your sleep pattern.
Diet, new baby.
Medical issues can...
Sure,
I mean, if you're waking up-
perimenopause, menopause, all of these things change your sleep cycle. But my belief, and those of my patients, is we need to sleep. We all have very busy lives. We need to sleep. So if you're having difficulty sleeping, I'm a firm believer that you need to take something. And you can start with over-the-counter medications such as Tylenol PM or Advil PM, which is basically just...
It's acetaminophen and diphenhydramine.
Exactly.
Which I don't know. I'm a little leery about that, only because there's pharmacies everywhere. Patients don't come to you for that. They just go and do it on their own. I'm worried that they're taking it and they're not really getting a restful night's sleep. They're getting knocked out with the diphenhydramine, and it sort of makes them feel groggy.
Most people do complain of a hangover, you are correct, from the diphenhydramine. And if you really are a purist, I will tell people just to buy Benadryl. You don't need the Tylenol or Advil unless you're in pain. But then we need to move on to other classes of drugs, depending on whether it's stress and anxiety that's not allowing you to fall asleep, a new job, a change in your lifestyle. And then we use drugs such as Xanax, Valium, Ativan, which relax patients.
So Xanax, Valium, Ativan are all a class of drugs called benzodiazepines, which are known to be sedating.
Correct.
And they were widely used in the 70s and 80s, maybe overused. And, you know, the only thing is, I find those are very highly addictive.
We have a problem with that more so with the Ambien and the Lunestas, where people really love the idea that they take it and 10 minutes later they're asleep and they wake up and it's morning. What I try to do with the patients is say things like, how about 3 nights a week?
So your first go-to prescription drug would be maybe Ambien?
I'm a big believer in Ambien.
Right.
And not generic Ambien.
So regular Ambien, because generic doesn't have
Ambien.
the 100% ingredients. That's what a generic is. It doesn't have to have the 100%
Correct.
Dr. Nancy,
ingredients.
how do you deal with the side effects? How do you deal with the poor quality of sleep that you actually get with the drugs? When does it end? The cycle has to end.
The cycle has to end, says who? That's the problem. The literature does not support longevity studies. What it does support is that people do have side effects, such as short-term memory loss. And if a patient says to me, I was walking down the street and I saw my neighbor and I couldn't get the name out quickly, I must get them off of Ambien.
Should people be driving or operating machinery when they're on Ambien and Ativan?
No, there is a warning about using Ambien and the warning is that if you wake up in the middle of the night...
So it's just for sleep, but if they wake up after sleep, does it affect them after?
I think it's getting a lot of bad press unnecessarily. I think 7 to 8 hours of sleep on Ambien, you wake up refreshed and ready to go, most people with minimal side effects.
And one tip it could be is not to take the whole dose, maybe just take half an Ambien
And
if
not
you're
every
going
night.
to take Ambien. So Dr. Shu, do you have any oral supplements you could recommend?
Herbal formulas are medicine, and you really should consult
I take that very seriously.
with a practitioner before you take
I
them.
would never take it on my own, I would ask.
So there's an herbal formula called Jiawei Xiaoyao San. That's generally an herbal formula that I give out for stress and for people who have difficulty falling asleep. And then there's one for people with difficulty staying asleep, and we call that Tianwang Bu Xingdan.
I can't wait to order that one online, I'm sure. All right, there were a lot of good points about sleep and some good discussion. We're going to take a break, and when we come back, we're moving on to from I can't sleep to I can't poop. And we'll debate treatments and those conditions that leave our bodies feeling completely out of whack. Welcome back to Dueling Doctors, the show where health experts from the worlds of conventional medicine and natural medicine debate the best ways to treat ailments and illnesses that affect us all. Today we're dealing with health issues that make our bodies feel simply out of whack. We started the show talking about insomnia, and now it's time to talk about constipation, or not being able to poop properly. Now, constipation is less frequent bowel movements or an inability to pass stool. It is marked by less than 3 bowel movements a week. Now, if you have chronic constipations, this could lead to consequences like hemorrhoids, abdominal pain, and gas, and could be a sign that something more underlying is really going on with your body. Each of our doctors has up to 1 minute to present a treatment plan, and then we'll debate the pros and cons of each. We're going to start with Dr. Nancy Simpkins.
Thank you so much. Okay, first of all, what I'd like to say about this is what's normal for you is not what's normal for everyone. So we take a history and we find out, what do you mean that you're constipated? Did you used to move your bowels every day and now it's down to twice a week?
Now, should you really go every day?
There's no should. There's what is right for you. I think most people feel better going every day, especially us skinny girls. We like to go every day. You feel flatter.
And you can eat more later.
Right. But the point is, if there's a big change, medically, we have to look for what caused the change. In other words, if you were always regular, going every day, and now you can't go, there's nothing different in your life, your diet, your exercise routine, the stress in your life. We need to do a medical workup, such as a colonoscopy.
All right, so person comes in, I haven't gone in several days. I usually go every day. My diet hasn't changed, because the number one thing is probably dietary changes. Fluids, not drinking enough fluids.
Right.
And so you're saying the physical exam, does that involve a rectal exam to even see if there's stool in the rectal vault?
A physical exam, feeling of the abdomen.
To make sure it's not
a rectal exam, seeing if there's blood,
possibly
seeing if there's
an abdominal X-ray.
An X-ray.
One of the most common causes of constipation is obstruction, and you could actually see
on an X-ray
material,
right, on a simple X-ray. You wouldn't need a CAT scan or an ultrasound, just a simple old-fashioned abdominal X-ray.
And then the idea is that maybe longer along the line, if you're still coming up without an issue, you might think about a colonoscopy. But there are other medical problems and also medications that you have to really
medications cause constipation. We go through a whole long list of
Number one
meds.
on that list, pain medication.
Pain medication.
Codeine slows down your digestive tract, and people get very constipated.
It's interesting, when patients have surgery, I always say to them, it's a trade-off. Wouldn't you rather have a little bit of pain than you would be constipated for a week post-operatively?
And I always tell patients, you're not leaving unless you can poop. So
exactly. So stop the codeine, stop all the Percocet. You need to get out and walk. So once patients are physically active, walking, eating well, and they still can't go, what can we use? So we start with a bulk agent, such as Metamucil, Benefiber,
so
anything
really
which is a natural fiber. When we find that doesn't work, there are colonic stimulant pills, things that actually stimulate the bowel. And I often say to patients, it's very personal.
Dr. Shu, constipation.
If it's primary constipation, we're talking about not something that's caused by another medical disease, which I would send a patient to Dr. Nancy for.
Okay, so we've ruled out medical issues. There's no obstruction. There's no cancer tumor, which everybody in their mother thinks it is first.
The treatment that a practitioner of traditional medicine is very, very similar to a treatment from an MD. I mean, you tell the patient to have more exercise, more fiber in their diet, more fluids if they're not having enough fluids, and even the medications that are given. The bulk fibers, the salts, the indigestible salts that are given also that the Western medicine gives. Now, and also we recommend more seeds and nuts. But there's something different in Eastern cultures and in a lot of other cultures that's different in this culture. In the Western culture, is the actual position that you're in when you poop. A lot of cultures now, from thousands of years ago and up to now, they squat.
Squat. So you would recommend squatting over your toilet bowl?
If you have trouble doing, well, they actually make things like there's something called a squatty potty, which you actually get your legs up into a squatting position while you're on the potty. If you're going to the bathroom and you're sitting, there's actually a muscle that's pulling on your colon, and it's bending the colon. When you're squatting, your colon is straight up and down, and it actually helps. With going to the bathroom.
So
that's one thing that physical thing that you can actually do to help go to the bathroom.
Other than water, increasing dietary fiber, which you can get from fruits, vegetables, anything that you could think of that's possibly
Well, again, in Chinese medicine, you do acupuncture and you can do herbs to kind of help that along. But you try everything else first.
That was a nice little powwow on poop. We're going to take a break, and when we come back, is your body out of whack with too little or too much energy? Are you mysteriously gaining or losing weight? might be time to take a look at possible thyroid issues and different ways to treat the problems. Welcome back to Dueling Doctors. We're talking today about issues that make your body feel out of whack. Insomnia, constipation, and now our thyroids. The thyroid is a gland around your neck. It has two lobes that's connected by an isthmus, and if actually, go ahead, do this. If you put your finger here and swallow, you can feel it go up and down. Now, the thyroid produces thyroid hormones, which help the body with metabolism, and they also regulate calcium homeostasis. Each of our doctors has up to 1 minute to present a treatment plan. Dr. Shu, take it away.
Well, in traditional medicine, they dealt a lot with hyperthyroid.
So let's just say this for a second. Your thyroid could be underfunctioning, called hypothyroid.
Hypo, yes.
And if it's hyperfunctioning, it's
Hyper.
hyperthyroid. And the symptoms are vastly different.
The symptoms are vastly different. If it's hyperfunctioning, you'd feel a lot of heat, anxiousness,
intolerance,
and you
can lose weight.
A lot of weight.
Right.
So traditionally, they would just treat the symptoms because back in the old days, they didn't know about it. Modern practitioners understand it just like MDs understand it. So when it comes to hyper, the modern practitioner of traditional medicine would send them to an MD to have it taken care of. And once that's taken care of and they come back hypo and they're on the Synthroid, it's one of those diseases or issues where traditional medicine like acupuncture and herbs work very, very well and synergistically with Western medicine. There's not much dueling here.
For hypo?
For hypo, yeah.
So hypo, let's just say, is the exact opposite of hyper, where people feel fatigued, they're cold intolerant, and they can gain weight.
And they need the Synthroid. But the acupuncture helps the body a lot with the symptoms that you're still going to get even if you're taking Synthroid.
So now also, thyroid disease has been known to be caused due to iodine deficiency.
Well, not so much anymore. Back in the old days,
in developing countries,
sure.
And there was a great paper that was just put out by the UK where women who were pregnant didn't know they were iodine deficient, and they gave birth, and this was just recently, with children who had mental defects and had movement disorders. So it actually still goes on, and it's worth investigating. I'm not saying it's going to really help, especially with autoimmune problems like Graves' disease. You could take all the iodine you want, it's not going to really help. So I agree. Sometimes it's more about just treating the symptoms.
Traditional formulas, Chinese formulas that dealt with the iodine deficiency actually had a lot of kelp in it and had a lot of seaweed in it, and that was in it.
Yeah, iodine.
Yeah, exactly.
Food. All right, so Dr. Nancy, I know you were like, no.
Well,
no,
I think
it's all about
the Synthroid.
Synthroid is a medication which you're giving thyroid hormone because the thyroid is not functioning enough.
That's correct.
Okay.
In other words, once we make the diagnosis, which, by the way, is done by very specific blood work, not just a screening thyroid test, it's done by multiple thyroid tests showing that there's just not enough thyroid hormone in the body.
I think it's important to just focus for 1 minute. This is a complex system. You have the brain triggering the pituitary gland to stimulate the thyroid to produce thyroid hormone. There could be something wrong in any one of those parts. Now, Synthroid, the reason why we give Synthroid is that we know that we're not producing enough thyroid, and the TSH, thyroid stimulating hormone, goes up. So these are blood tests measuring thyroid hormone, T4, T3, TSH. You can also measure antibodies to see if it is autoimmune. But once you've diagnosed hypothyroid, you're saying Synthroid.
That's it. That's the answer. And Synthroid is one of those medications that in recent years we've had a lot of problems with generics. A lot of problems being side effects,
or not as heart rate, dizziness,
right,
nausea.
And it's just that it's very hard to regulate. We have to do blood levels on these hormones, and we're finding that the generics, the blood levels are jumping all over, whereas the brand name, people stay consistent, and we don't have to keep checking them.
Now, what about if I don't want to use a synthetic medication? I don't want to take Synthroid. Do you ever recommend Armour Thyroid, which is made from porcine, pig, that's pig. I know if you're a vegan, you might not want to take that.
Well, I'm not a big fan of Armour Thyroid because Armour Thyroid targets one of the thyroid hormones called T3 as opposed to T4. Patients just don't feel as well on Armour Thyroid as they do on Synthroid.
Right, and you do need to check blood tests.
Correct.
Routinely. And also, I think the real conundrum there is that pigs are different than humans, so you're not getting
That's
the
exactly
same
right.
amount with some degree of variability. But so you do have to measure the thyroid hormones more frequently, but it is a natural-ish alternative.
Well, when you take thyroid hormones, you're going to have to, as an internist, you're going to have to change the levels here and there, and it's not always going to be exactly the same for everyone all the time for their whole lives. And it's those difficulties, those signs and those symptoms that you get when you're doing those changes where the acupuncture and the herbal medicine really help the body feel a lot better.
Well, I definitely think it's a disease state that you have to work in conjunction with East and West. Well, we need to wrap things up. I would like to thank both of you for being here with us today and giving us some great information about our thyroid gland, insomnia, and constipation. 3 issues that make our body feel completely out of whack. We'll be right back. Let's face it, nobody knows your body better than you. If you feel out of whack, chances are you're right, so trust your instincts. If you're feeling constipated, add more fiber to your diet. And as my mom always says, drink plenty of water, Frank. If you feel tired, weak, and cold, or just the opposite, ask your doctor about thyroid disease. There is an easy blood test to put your mind at ease. And if there is something wrong, know there are various treatments available. And finally, insomnia usually involves stress. Try to figure out what's weighing heavy on your mind. And before you reach for a pill, remember to prepare yourself for sleep by avoiding TV, electronic devices, and treating your bedroom like a home office. Try a little lavender oil, earplugs, or even a night mask. And if you wake up in the middle of the night, have a cup of chamomile tea and read a book instead. I'm Dr. Frank Spinelli. Hope to see you soon on Dueling Doctors for more healthy discussions as you explore the best path for your own personal prescription. And as always, be sure to talk to your healthcare provider before making any medical decisions. See you next time.